I get a lot of questions about what is frozen shoulder. Just so you know, frozen shoulder is a dysfunction that happens to women more than men, specifically between the ages of, let's say, 45, 55, 60. And I don't know if you know this, but between all those ages, women have massive hormone shifts. So the hormone shifts, changes in your glucose, so say you have diabetes, changes in thyroid issues, systemic issues chemically can manifest orthopedically in a frozen shoulder. This would be what is called primary frozen shoulder. Primary frozen shoulder has an insidious onset and it'll come on. You don't have a mechanism of injury. You don't understand why, but your pain is incredibly self-limiting. The pain is debilitating. You're unable to lift your arm up. You can't put deodorant on. You can't do your hair. You can't brush your hair. You can't wash your hair. And you don't even know what you did. And one of the telltale signs as a physical therapist is when I go to do your passive range of motion, meaning me move you, I can't. You can move your arm greater than what I can. So your active range of motion is greater than your passive range of motion. This is always opposite of what we see with any other orthopedic issue in physical therapy. Frozen shoulder is a systemic thing that manifests in the shoulder, specifically your coracohumeral ligament. It kind of scars down, tightens down, your long head of your bicep goes up in here, and this acts like a check rein ligament and doesn't allow motion to happen. So your capsule, your tendons, your pain, and there are 3 phases of frozen shoulder: freezing, frozen, and thawing. And freezing is super painful. Frozen is kind of like baseline. You really can't do anything anymore, but it doesn't hurt as bad. Thawing, it hurts again, but you're starting to get some motion back. I have a TikTok series I created based on all my comments that you guys made about frozen shoulder and what to do to treat it at home. I always recommend, if you have frozen shoulder, to go talk to your primary care doc. We know in research that primary care docs do a really good job managing this, but I also want you to talk to them about what's happening to you hormonally, systemically. How's your thyroid? How's your glucose? Are you diabetic and you don't know it? Are you perimenopause and need some estrogen? Because all these things can really affect your frozen shoulder. And we know that women are not little men and your hormones matter. And when your hormones leave and your estrogen goes down, your risk for frozen shoulder goes up. So if you want, check out my TikTok series for frozen shoulder treatment based on you guys and all your requests. If your friend has frozen shoulder, it is literally the worst. It stinks. What stinks worse than that is probably shingles is right up there. Yeah, shingles is pretty terrible too.